If we treat varicose veins fairly early on, the extent of the treatment is not so invasive. We can normally treat most varicose veins under ultrasound-guided sclerotherapy, but if it becomes quite extensive and left for a number of years, then we do need to use laser fibres as a general rule. The scope of work that we can provide in the treatment of venous disorders at the clinic really extends across the full scope of varicose veins through to spider veins on the legs. In about the year 2000, there was the development of foam sclerotherapy, where we could mix the solutions and turn them into microfoam, and what this did was allowed us to actually track and visualize the movement of the sclerosant through the veins. So this allowed us to be much more accurate about precisely locating where to put the sclerosant and where not to put the sclerosant. When people come in for assessment, it's important that we do this properly and we examine them from the groin right down to the ankle, looking at the superficial veins and looking at the deep veins. And we can do this with ultrasound now these days in the clinic. An ultrasound normally only takes about 30 minutes, and we can map out the veins and determine which ones are working properly, which ones are not working properly. And once that's done, then we can create a treatment plan for the patients, explain to them what the steps are involved in going from the start of the treatment through to the end of the treatment. Normally this might take a few months to have the treatment completed in its entirety, because it might start with laser, and then there would be ultrasound guided sclerotherapy, and then it might involve treatment of spider veins. With very large varicose veins, there's been a movement towards endovenous techniques, which involve using laser fibres, which we can insert into very large veins and treat them on a same-day walk-in, walk-out basis. So patients can come in the morning, have the treatment, and then they can we encourage them, they have to go for their walk for half an hour, and once they've done that, they can then continue with their activities for the rest of the day. They can go back to work. We don't like them to do any vigorous exercise like going straight to the gym from the clinic, but essentially their lives can carry on as normal. Treating varicose veins can be, from a doctor's point of view, very rewarding, because patients are so happy that they've had something that they've become quite despondent about because they may have had surgery and it's failed. They come back to us with a sense that we've done the job well for them, and we've been able to meet their expectations, and often more than what their expectations were to start with.